Merci and good afternoon. I'm Rona Ambrose, Canada's Minister of Health. I am here to confirm North America's first human case of H5N1, also known as avian flu. The Public Health Agency of Canada has confirmed that a resident of Alberta, Canada, who recently returned from a trip to China has died of H5N1. The health system did everything it could for this individual, and our thoughts are with the family at this time. As Canada's Health Minister, I want to reassure the public that this is an isolated case. The risk of H5N1 to Canadians is very low. There is no evidence of sustained human-to-human transmission. It is also important for Canadians to know that this case is not part of the seasonal flu, which circulates in Canada every year.
The risk to Canadians is low. There is no evidence of human-to-human transmission of the virus. It is important to note that this is not part of the seasonal flu that circulates in Canada every year. This is an isolated case.
And the Public Health Agency of Canada is committed to disease surveillance and is working closely with its public health partners across the country and around the world. The Public Health Agency of Canada continues to work closely with Alberta Health and other provincial health authorities to ensure the health and safety of Canadians. The Public Health Agency has notified China, the World Health Organization, and other international partners about the case, in keeping with our commitment under the international health regulations. Our government will work closely with its national and international partners, including the World Health Organization. The agency will also continue to work closely with Chinese authorities to follow up on the source and circumstances of this infection. We are holding today's technical briefing to deliver a clear message to Canadians. The risk of getting H5N1 is very low. This is not the regular seasonal flu. This is an isolated case. Our government is committed to ensuring that Canadians have up-to-date, accurate information, and we will continue to communicate in an open and transparent way.
We are holding this technical briefing today to give Canadians a clear message. The risk of contracting the H5N1 virus is extremely low, and it is not part of the regular seasonal flu. Our government is determined to ensure that Canadians have specific and current information on this situation. We will continue to communicate to Canadians in a transparent manner.
Deputy Chief Public Health Officer for Canada.
Thank you, Minister. I'd like to echo the Minister's comments in extending our condolences to the family and friends of this individual. H5N1 influenza is not the same as seasonal flu. This is the first and only confirmed case of H5N1 in North America. The risk of transmission is very low. There is no evidence of sustained human-to-human transmission. H5N1 is an avian form of influenza which has been found to circulate among birds, mainly poultry. It has been found in birds in Asia, Europe, Africa, and the Middle East. There has only been less than 650 human cases of H5N1 in 15 countries over the last decade, primarily in people who are exposed to infected birds. The illness it causes in humans is severe and kills about 60% of those who are infected. No other illnesses of this type have been identified in Canada since the traveler returned from China. This is an isolated case. The individual began to feel unwell on a return flight from Beijing to Vancouver on Air Canada 030 and Vancouver to Edmonton, Air Canada 244, on December the 27th, 2013. The symptoms worsened and the individual was hospitalized and passed away on January the 3rd. The Public Health Agency of Canada was notified on January the 5th of the case by Alberta. Our National Microbiology Lab in Winnipeg received specimens yesterday. Last night, January the 7th, lab results confirmed this was H5N1. This morning, Canadian officials have been in contact with the World Health Organization. The patient's family is not showing any signs of illness. There is no evidence of human-to-human transmission on airplanes. All evidence is indicating that this is one isolated case in an individual who is infected following exposure in China. Although we don't know at this time how the individual contracted the virus, for Canadians traveling abroad, in keeping with our usual travel health advice, we recommend, if you are traveling to an area where any avian influenza is a concern, avoid high-risk areas such as poultry farms and live animal markets. Avoid unnecessary contact with birds, including chickens, ducks, and wild birds. Avoid surfaces that may have had bird droppings or secretions on them, and ensure that all poultry dishes are well cooked, including eggs. Thank you. Dr. New?
Merci, Madame la Ministre.
Thank you, Minister. I'd like to join my voice to that of the ministers in extending my sincere condolences to the family of the victim. H5N1 influenza is not the same as seasonal flu. This is the first and only confirmed case, human case of H5N1 in North America. The risk of transmission is very low. There is no evidence of human-to-human transmission at this time. The H5N1 virus is an avian form of influenza that circulates among birds, particularly poultry. This has been seen in birds in Asia, Europe, Africa, and the Middle East. Approximately 650 individuals were infected by H1N1 influenza over the last 10 years. Particularly people who were exposed to infected birds. The disease that this virus causes is serious and kills about 60% of victims. No other disease of this nature has been detected in Canada since this traveler returned to Canada. To date, we're talking about an isolated case. This person began to feel ill on December 27th on a return flight to Canada, specifically Air Canada Flight 030 from Beijing to Vancouver and Flight 244 from Vancouver to Edmonton. The symptoms became worse and the person was then hospitalized and died on January 3rd. On January 5th, Alberta informed the Public Health Agency of Canada of a potential case of contamination. The National Microbiological Laboratory received the specimens yesterday, and last night, on January 7th, the results from the laboratory confirmed that this was indeed H5N1. This morning, Canadian representatives communicated with the World Health Organization. The family of the patient is showing no signs of disease. There is no evidence of human-to-human transmission. The evidence indicates that this is an isolated case, the case of an individual who was infected after exposure in China. Although we do not know at this point how the person contracted the virus, if Canadians are traveling abroad, consistent with our usual advice, we recommend that if you are traveling to an area where there is a risk of avian flu contamination, do avoid any risky areas such as poultry farms, and avoid all direct contact with birds, particularly poultry, duck, and wild birds. You should also avoid any potentially contaminated areas with bird excrement and ensure that all poultry and egg products are well cooked. Thank you. Thank you, Dr. New. We will now proceed with the question and answer period. Please press 1 on the phone line if you wish to ask a question.
One question per person, please, and please limit questions to the topic mentioned today of H5N1. Le H5N1 est le sujet à discuter aujourd'hui.
H5N1 is the subject today. Star 1 to ask questions. We will now begin with questions in the room. Mr. Thibault, Radio-Canada. Good afternoon. Dr. New, I'd like to hear your comments with respect to the risk of contamination, or human-to-human contamination. You have referred to poultry to human transmission. And I'd also like to ask a question about the victim. You said that the family of the victim is not in danger. What about the people who treated the individual while in hospital? I cannot answer that question because I don't have those details. I'd like to ask Dr. Jim Talbot if he can answer that question. I'm not sure that he understands French.
Concerning, I guess, the individual and what may have happened in terms of
Perhaps we can first hear from you about the risks of contamination. Well, at this point, there is no evidence of human-to-human transmission. There have been a couple of situations in China where there were families living in close contact, and there were several members of the same family who became infected. But there's no evidence of human-to-human transmission.
Can you tell me, sir, what's been done to make sure that the hospital personnel that took care of this individual is being followed to make sure they're not contaminated?
Sure. So I'll give the complete story just so that we don't do this in pieces by the questions, if that's all right. We also have expressed our condolences to the family once the result was confirmed yesterday. Our first step was to have the local medical officer of health express our condolences to the family. As you'll see, we had been in contact with them for some time before that. On December 27th, has been said, the Albertan in question was on a flight from Beijing and was symptomatic. On January 1st, they were admitted to hospital. January 2nd, specimens were taken. January 3rd, unfortunately, her clinical course was very rapid deterioration, which was of concern to the staff, and she died. Public health was informed that same day and began close contact follow-up, both within the hospital and with the family. And they did so even though H5N1 is circulating, because they were aware of the contact in China. And on January 5th, our provincial lab identified that it was not H1 or H3, the more common strains, and we gave a heads up to PIAC to make them aware of that. January 7th, it was confirmed as H5N1.
Can you tell me, sir, what's been done to make sure that the hospital personnel that took care of this individual is being followed to make sure they're not contaminated?
Sure. So I'll give the complete story just so that we don't do this in pieces by the questions, if that's all right. We also have expressed our condolences to the family once the result was confirmed yesterday. Our first step was to have the local medical officer of health express our condolences to the family. As you'll see, we had been in contact with them for some time before that. On December 27th, has been said that the Albertan in question was on a flight from Beijing and was symptomatic. On January 1st, they were admitted to hospital. January 2nd, specimens were taken. January 3rd, unfortunately, her clinical course was very rapid deterioration, which was of concern to the staff, and she died. Public health was informed that same day and began close contact follow-up, both within the hospital and with the family. And they did so even though H5N1 is circulating, because they were aware of the contact in China. And on January 5th, our provincial lab identified that it was not H1 or H3, the more common strains, and we gave a heads up to PIAC to make them aware of that. January 7th, it was confirmed as H5N1. For all of the close contacts that have been identified, as we said, person-to-person contact is extremely rare, but because we wanted to be very cautious, we had offered Tamiflu to them, and many of them have taken advantage of that. We have continued to monitor all of them, and there are no symptoms and no illnesses, so I am confident that the chance of transmission is extremely low.
Thank you, Dr. Talbot. We'll proceed to the next question in the room. Please identify yourself as well.
Hi, Chris Rand, CBC Television. just to get a profile of the victim, could we have his age, his gender, I assume it's a him from what we've said, his name, his occupation, and when he was in China, China obviously being a very, very large country, did he just visit Metro Beijing, or was there a province that he went to? Because my BlackBerry is being sent emails about outbreaks in Tibet and the southeast and elsewhere. So I'm packing a bunch into my one question, but to tell the story, I need more than just a man who's died in Alberta.
Perhaps I can start with that. We have no evidence in China and Beijing specifically of this virus being infected in poultry. So as you can imagine, China will be very, very interested in this story. I'll let Jim answer some of the questions in terms of the specifics, but our understanding at this time is that the person only visited in Beijing. Jim, did you want to answer some of the questions regarding some of the details?
First of all, I haven't identified gender. I won't be identifying age and occupation. We do that as a matter of course in Alberta to protect confidentiality for both the individual and the family. I can confirm that the information that we have is that they were only in Beijing and that they did not travel to a farm or visit markets. So, as I said, that's the way we handle them, to respect confidentiality. If the family chooses to talk about it or media find out through their own sources, we can't control that, but in public health, confidentiality is a core issue.
And perhaps I can amplify that. As was stated, the chances of transmission from human to human are extremely small. If there was a situation where somebody came into the country and there was a high risk of transmission, we would be identifying, we would be pursuing that. But in this case, the human-to-human transmission is extremely small. As I mentioned, there is no evidence in the world of somebody getting infected on travel on an airplane.
Thank you. I'd like to remind those on the phone to press *1 if you wish to ask a question. Un rappel aux gens au téléphone. Appuyez sur les boutons étoile 1 si vous désirez poser une question. We'll take one more question in the room and then we'll go to the phones.
It's Mike Lucatur with Global National. First, for the doctor on the phone in Alberta. Sorry, just in your description, you mentioned she. So we all have that kind of recorded. I want to make sure. Can you confirm that it's a female then, first of all?
So far, in terms of the call, we have both a he and a she. As I said, I'm not confirming gender.
Okay.
The issue, in addition to what Greg has pointed out, is that we have so few deaths, severe deaths of this kind, that giving any kind of information automatically identifies the person involved.
Okay, so my question then is, on behalf of Health Canada, are you advising then if this person was just in Beijing for Canadians not to travel to Beijing at this point in time, seeing as how this has happened?
Absolutely not. We're not changing that advice at all. As I mentioned, this is the first evidence that this particular virus is circulating in Beijing. Chinese authorities are going to be very interested. We contacted them already. The advice I outlined in my opening comments is exactly the advice we're staying. The risk to travel is still extremely low. Avoid those areas. Avoid live birds. That doesn't change that at all.
Thank you very much. Merci, Dr. Taylor. We'll proceed to a caller on the phone. Operator, can you let the first caller in, please? Procède à la première demande, s'il vous plaît.
Thank you. First question is from Avis Favaro from CTV National News. Please go ahead.
Yes, thank you. Can you tell me what kind of precautions were taken in hospital when this patient was there? Was the patient isolated? And what level of precautions did the staff have to take in order to deal with the care?
Jim, I'll refer that to you, Jim.
Sure. So one of the unusual features of this case is that at no time did they have a cough. They did not have respiratory-type symptoms. And in fact, the cause of death is listed as meningoencephalitis. So for some H5N1s, that is a typical course, and they tend to deteriorate pretty rapidly. So standard precautions were observed, and in terms of barrier protection, gloving, I don't have at my fingertips whether she was in respiratory isolation, but it would be unusual to have respiratory isolation in an ICU, and she went to that fairly quickly. And so public health's major questions were exactly those when they went into the hospital, and they worked with infection control to identify everyone who would have been in contact with this patient. And though, as I said, that was part of the contact tracing that was done. And all of those people were informed that the chances of transmission were low, because at that point, when we first contacted them, this was an unusual case for which we did not have an etiology, but they were offered Tamiflu as a potential precaution. And as we said, we have been following all of them since, and it's now January 8th, so it's 5 days since her death, and none of them have, as we would expect, none of them have developed symptoms.
Thanks, Jim.
Thank you, Dr. Talbot. We'll proceed to the next question on the phone, please. La prochaine question.
Thank you. Next question is from Helen Branswell from the Canadian Press. Please go ahead.
Hi, thank you for taking my question, and I'm sorry if I'm asking something that you've already answered. Can you please tell me, did this person travel with family members or friends, and if yes, how many, and how long do you intend to follow them out?
Jim, did you want to respond to that as well?
Sure. They traveled with 2 companions who were part of the group of close contacts that are being followed by public health in terms of their home, and we're going to be following them for at least 10 days. Ordinarily, symptoms develop within 2 to 5 days of exposure to influenza in general, and so we're erring on the side of caution, and we'll continue to follow them for at least that period of time.
Merci. Thank you. Next question, please. Prochaine question au téléphone.
Next question is from Neil Rao from CTV News. Please go ahead.
First, I want to commend you guys for making a very rare diagnosis with an exceptional clinical presentation. Just wanted to clarify from the information we heard, was this more of an encephalitis type of presentation rather than a pneumonic illness, in which case standard precautions rather than airborne precautions or droplet precautions would have been used?
Jim?
That's correct. At no time did she cough, and the major system that was compromised was her central nervous system. To make clear that I'm saying her because I've just given up on saying they, but still haven't confirmed the gender.
Merci. Thank you, Dr. Talbot. We'll proceed to the next question on the phone, please.
Thank you. Next question is from Tom Blackwell for the National Post. Please go ahead.
Hi, thank you very much. I wonder if you could say, with regards to the patient, whether the patient had any sort of comorbidities, or was this a generally sort of healthy person? Can you give some idea as to what their sort of health status was at the time they got sick?
My understanding is that it was a healthy individual. Jim, did you want to augment that?
They were a healthy individual. One of the things that came up in the lab tests was a garden variety infection with another virus called coronavirus. We made absolutely sure that it's not the one that's associated with SARS. It's the one that we see regularly. So in the beginning, we were entertaining the possibility it was the combination of the 2 viruses that made for the more severe outcome, but because H5 is known to cause this kind of course, we don't think that that's as likely anymore.
Thanks.
La prochaine question. Next question, please.
Question is from Don Braid from Calgary Herald. Please go ahead.
I would like to ask Minister Ambrose a question about H5N1 nationally. If you won't entertain it, I'll withdraw.
Minister Ambrose?
Hi, Minister Ambrose here. In terms of H5N1 nationally, what is your question?
I just wanted to ask you how you view nationally the H5N1 spread, which has become quite serious in Calgary. We've had 10 people die in the city. And I'm just wondering how you view this as a national problem.
Well, I think I'll pass that over to Dr. Taylor, and specifically from the Alberta perspective. My understanding is that the Alberta flu season is a normal flu season. But I'll hand it over to Dr. Taylor to answer.
Yeah, thank you, Minister. As the outset, we'd like to focus this particular briefing on the H5N1. A lot of the provinces are having their own briefings in the next little while. We've posted some of the national numbers across Canada on our website, and it looks like a normal season for the seasonal influenza. There's more than just H1N1. It's the predominant strain, but I think that's a topic of a different presentation. We'd like to focus on the H5N1 today, please.
Thank you, Dr. Taylor. A reminder to all that today's press conference is focusing on H5N1. We ask that questions respect that. Thank you. Prochaine question au téléphone, s'il vous plaît.
Thank you. The next question is from Ray Chan from Singtao Daily. Please go ahead.
Hello. Yeah, I have a question for two parts. First is that Canada has to raise a travel alert on China. Second thing is that the public health agency is that going to screen those travelers before they board the flight or and the entry port. So just like last time when we have SARS.
I'm not sure I understand your question. Could you repeat that, please?
Yeah, the first part is that Canada is going to raise the red flag, said travel alert, said that people don't go to China or something. Take precaution. The second part is that when during the SARS season and public health agency have people before they on board the flight, they have to measure the temperature and other things to see if other symptom. And also when they arrive Canada, there's an officer looking for everybody if they're all right. So is that Canada is going to take this measure now?
No, we are not implementing or advising any of those. Certainly, our normal travel advice, as I mentioned earlier, if you're traveling into areas where there is any sort of avian influenza present in poultry, take precautions to do that. We are notifying China. We are talking to China. As I mentioned earlier, they're going to be very interested in this because there are no recorded instances of H5N1 in Beijing poultry. And we're not taking any precautions at the border. Again, this is the very first case that's been identified in North America. So there's no evidence or any need from our perspective to put those measures in place. But perhaps I could ask Dr. Tam to speak to this. Dr. Tam is an internationally recognized expert in this field, works at the agency. Perhaps she would like to comment on some of the measures.
I just want to reiterate that this is not a disease that's transmitted between humans. So unless you were in the affected area and in contact with a bird or infected bird, you're not going to get this illness. And just to reiterate also, there is no plan to stand up any specific screening measures. These are not warranted. However, the Public Health Agency does have staff across all international airports and keep a close eye on all ports of entry. So if anyone is sick on flights or during transit, the normal protocol is that we will be alerted and we will be responding rapidly to those situations.
Thank you, Dr. Tam.
And we'll proceed to the next question. Prochaine question, s'il vous plaît.
Thank you. Prochaine question de René Pellerin de CBC. Please go ahead. À vous la parole.
Yes, thank you for taking my question. I was wondering if you could clarify what symptoms the individual in Alberta presented with and if they are the usual H5N1 symptoms.
Jane, would you like to field that?
Sure. The patient had fever and then decreasing CNS consciousness, which is what required her to go so quickly to the ICU. As I said, there wasn't a cough and there wasn't respiratory. So the meningoencephalitis kind of presentation is more consistent with a subset of H5 cases which don't start with a primary respiratory kind of presentation.
Thank you.
Next question, please. La prochaine question.
Thank you. Next question is from Farah Murley from CBC News Vancouver. Please go ahead.
Hi there. We just wanted to clarify some of the details of the travel plan of the victim. Did he or she change planes in Vancouver, or did he stop over in Vancouver, or was it a direct flight from Edmonton to Vancouver?
The flight numbers as I gave, the person on a flight from Beijing to Vancouver on Air Canada 030 spent, we believe, a couple of hours in the Vancouver airport and then took a flight from Vancouver to Edmonton, Air Canada 244. I think I want to emphasize that we do not feel there's a risk to either the individuals on the airplane with this one or any of the people at the airport.
Thank you, Dr. Taylor. We'll go to the next question on the phone, please. Prochaine question.
Thank you. Next question is from Heather Urich from Global News Calgary. Please go ahead.
Yeah, for Dr. Talbot, what hospital was this patient treated at in Edmonton?
Sorry, we're not confirming the city that was the destination. Edmonton was just the destination of the plane, not of the person involved. And again, there's so few cases that if we were to start to reveal the city, we would actually be giving away the identity of the person. Just as a follow-up to one of the questions that was asked previously, the presenting symptoms were fever, malaise, and headache. So, as I said, that's more consistent with the meningoencephalitis. But those of you who are physicians might not make that linkage.
Thanks, Jim.
Thank you for that. We will take two more questions from the phone, which will then complete this conference for today. Donc, prochain appel au téléphone, s'il vous plaît.
Thank you. The first question is from Elizabeth St. Philip, CTV National News. Please go ahead.
Yes, will you be contacting the individuals on the flight, the Air Canada flights that this individual traveled on?
We are going to. We have secured the passenger lists, and we plan to contact those individuals, not to worry them, but to reassure those individuals. I deliberately gave the flight numbers, and so that's going out in the media, so that gets to people very quickly, and they will know that they've been on those flights. For those individuals who won't see this or don't see this for some reason, we will be following up to reassure Canadians, reassure those Canadians specifically that we think the risk is extremely low.
Thank you, Doc.
Follow up, Greg, if it's okay. Given that the flight numbers are out, at least for Albertans, we're going to be recommending, because we think the risk of transmission is low, if they develop symptoms, they should give their local medical officer of health a call.
Super. Thanks, Jim. That's great.
This is the last question, la dernière question au téléphone, s'il vous plaît.
Thank you. The last question is from Marin Warnica from CBC News Edmonton. Please go ahead.
Hi. Actually, mine was asked in a previous question, but if I may ask, just to repeat those flight numbers for us?
Sure. The flight from Beijing to Vancouver on December 27th, Air Canada 030. Vancouver to Edmonton on December 27th, Air Canada 244.
Thank you very much. Merci à tous. Ceci termine notre conférence de presse pour aujourd'hui.
This press conference for today.
For any additional questions on flu cases or surveillance data, they are available on the Public Health Agency of Canada website. As well, any details beyond that can be obtained from each provincial or territorial Ministry of Health. And the number for inquiries at the Public Health Agency of Canada, if necessary, are 613-957-2983 au 613-957-2983. Je vous remercie. Bonne fin de journée. Have a great day.